Thank you. Good afternoon. I'd like to talk about the oncological value of Lutetium-177 PSMA therapy for mCRPC. So tumor cell irradiation by using this radiopharmaceutical therapy is different from conventional radiation therapy in terms of the physical location where the irradiation starts. This ligand goes into the tumor, radiates right next to the cell or sometimes inside the cells, which enables both imaging and treatment. So it can identify patients who highly express this PSMA, which act as a receptor to this radionuclide, and they are the patients who are likely to benefit from the therapies. And currently, the trials have shown high activity with a relatively low toxicity profile for treating the patients who have progressed after conventional therapies. A recently published systemic review and meta-analysis indicate that the drugs is highly effective in patients who progressed after conventional therapies. And this year, the published Vision blinded randomized phase 2 trials have shown improved progression-free survival and overall survival compared to standard care. And another THERAP trials have shown that the 177 lutetium PSMA was beneficial in contrary to the carbotoxic group for PSA responses and relatively low grade 3 to 4 adverse event frequencies. And there is an ongoing and planned trials also. So if you look at the schematic overview of ongoing PSMA theranostics clinical trials, mostly are on second line or later therapy for mCRPCs, but there is a first line for mCRPCs, and I guess we will see more interest in first line therapy for HSPC and also neoadjuvant for localized diseases. For prognostic biomarkers, the PSMA mean density is a positive indicator, whereas the FDG PET volume is a negative indicator of the responses, which imply that the PSMA positive mCRPCs might be different from those FDG positive diseases. And there is also relation to the bone scan index and the LDH, ALP, those bone metabolism markers. Also, these nomograms show that the conventional biomarkers for these androgen targeting therapies, such as hemostatus, baseline hemoglobin levels, and the burden of tumors, including the hepatic metastasis, are all risk factors for these new therapeutic options. My personal interest is on the role of genomic background to these new drugs. That for this publication shows that mutations of homologous recombination repair genes, which is related to the PARP inhibitors, or mismatch repair genes, which is related to the PD-L1 inhibitors, were not associated with this 177 therapy efficacies. This might be relevant to DNA damage, to the fact that the DNA damage repair genes mutated cancers do not express high PSMA. And this publication is even show that the patients who are resistant to the PSMA targeting alpha radiations often harbor mutations in DNA damage repair associated genes such as ATM, BRCA1, MSH26, and BRCA2. And it is in contrast to the radium-223, both have alpha radiations. So for radiums, the efficacy of this drug in bone metastatic CRPCs was shown with the homologous repair gene defects. So men with HRD mutations had higher responses to the radium-223 alpha nucleate. Lastly, I'd like to show some, there's a chance for immunogenic priming of these agents to the pembrolizumab. So pembrolizumab is currently indicated for patients who are MSI high or have high tumor mutational burdens, but these groups have examined 14 patients, all had somatic genomic data available, and they do not have such MSA high or tumor mutational burdens, or even DNA mutation burdens, DNA repair mutations. But there was a small number of responses to the pembrolizumab. So this might be related to the role in immunogenic priming, as well as the unknown role of immune cells in the mechanism of 177 lutetiums. So there are many aspects to optimize the PSMA theranostics. For clinicians, we may be interested in the combination of these drugs to the PARP inhibitors or chemotherapies, as well as the androgen targeting agents, enzalutamide, abiraterone, which have may increase the PSMA expression at first, and there is a chance that it can be optimized, can be used as immunopriming agents with the use of anti-PD-1s. For conclusions, the Lutetium-177 PSMA radioligand therapy will be a new valuable tool for advanced prostate cancer treatment soon, and given that the appropriate patient selection should be done by gallium PSMA PET and FDG PET and potentially the genomic studies. Thank you.